Happy Monday, everyone. We hope you had a wonderful weekend, and we are back again to get you started on another exercise program.
Awesome. Well, hi, I'm Allie. In case you didn't know me, I'm one of the physical therapists here at Lake Area Therapy, and this is Stephanie. She's our massage therapist. She's also our front desk person, but today she's going to be our fake patient. And
you can call me Jane Fonda for today.
Just wait for it. Great. But today our primary activity here is going to be focused on knee exercises. These knee exercises can be done for anybody who's having knee pain. They should all be relatively safe, but the primary idea that we had was for people who have had to delay their total knee replacement surgery amidst all this COVID-19 stuff. We thought we'd give you guys some exercises to help with just kind of managing your symptoms and also preparing for surgery so that when it is finally time to get your knee replaced or have your knee surgery, you'll be good to go. But that doesn't mean that that's the only people who would benefit from this video. If you have arthritis, knee pain, or maybe just want something different to try out, this video could be for you also. So without further ado, we will get started. Stephanie, would you lay down on your back with your head on this end and your feet down here? Oh, yes. Okay. So I'm going to introduce a couple of supplies that are going to be helpful for this exercise routine as well. So one of the props that we're going to be using is a foam roller, but it is about the diameter of a Folgers coffee can, so Folgers coffee can works well, or you can roll up a beach towel. It just needs to be maybe about 6 inches wide and something that has a little bit of a rolled up kind of feeling to it. It's going to go underneath your knee. It doesn't need to be anything fancy, but if you have a foam roller, those also work great. The next supply is going to be a hand towel. So we're going to roll this up at some point, or something that's similar in size and shape to that. And then the last supply that we'll use is a belt. You don't want something that's stretchy, so a belt that you would just use around your waist. If you have a gait belt at home, I know some people do have gait belts if they've had previous hospitalizations or anybody in their family who's been in a nursing home at any point in time. Sometimes you have these laying around. Otherwise, other props that work well for this would be a dog leash or a rope. But oftentimes I get people saying, oh, I can just use one of those TheraBands I had from one of my old therapy sessions. A TheraBand is too stretchy for the things we're going to use it for today. So do not use a TheraBand. It needs to be something sturdy. Alrighty, so Stephanie, this is the knee that we're going to focus on right now. I might switch knees back and forth throughout the duration of this video, just so that you can see the leg that is easiest to see for each exercise. But what I want you to do first is to straighten this knee. We're going to roll this hand towel up and put it right underneath your knee here, right behind your knee. Just to give you some sensation back here, it generally kind of feels good to have your knee resting. And what I want you to do, Steph, is to press your kneecap down so that your leg straightens. You should feel your quad tense up here. If you feel your butt muscles or hips doing the work, then rest and try again. You really want the top of your thigh or your quad to be the part of the leg that's doing the work. It's not necessary to have something underneath your knee here, but it's just nice to give you something to press into. And then rest. So generally you're holding this contraction of the quad for about 3 to 5 seconds and doing about 3 sets of 10 repetitions. So you're just activating the quadricep muscle here. This is actually one of the very first exercises they'll give you post-op after you have pretty much any type of knee surgery. And many people say that if they're having pain or discomfort at night when they're sleeping, that laying in bed and doing quad sets, like if they wake up because of pain and discomfort, that doing quad sets usually kind of calms the knee down a little bit. So it's not a very big or exciting exercise, but it is kind of the foundation of everything that we're going to build off of. Alrighty, I'm going to remove this. And next, we'll take our bolster or our foam roller. or your rolled up beach towel, or Folgers coffee can, and place it right underneath the knee. You can actually rest both of them on there if you'd like to. And again, you're going to press your kneecap down into the bolster. Your knee stays in contact with the bolster, but your leg is raising, your heel is raising up off of the table. Again, the primary muscle working here should be your quad, and then slowly lower back down. Good, so this is called a short arc quad, because you're moving through just part of the arc of knee flexion and extension. Just like the quad sets we just reviewed, you would do 3 sets of 10. And again, this should be a relatively pain-free exercise. I like that you just pointed your toes up towards the ceiling too. That's good form. Just like your quad set, you don't want to really be feeling this too much in your glutes. It should mostly be coming from the top of your thigh. You should be able to see or feel your kneecap raise up a little bit too. Unless you have really swollen knees or if you have a lot of inflammation going on, you might not see or feel the kneecap move in an upward direction, but many people will be able to see that movement of the kneecap. All right, I'm going to lift this back up. Keep your knees bent. Next up, we're going to take our belt. You're going to create a loop at the end of your belt. So that's why I said if you have a dog leash, it works great, because usually there's already a handle there. Keep this leg bent where it's comfortable. You're going to loop the bottom of your foot, and then I'm going to give you the strap here, the belt. You're going to keep your legs straight and use your arms to pull the legs straight up into the air. Your leg is just resting here. Your arms are doing all of the work. You should feel a nice stretch back behind your knee and your hamstring. But depending on how tight you are, you might feel this into your calf. You might feel it into your foot. And if you have some tightness in your lower back, you might also feel it in your lower back and hip. Generally for stretching, I want people to try to hold the stretch for a minimum of 30 seconds. That gives enough time for the muscle fibers to make physiological changes. If you're only holding it for 5 or 10 seconds, the muscle fibers are just going to recoil back to that tightened state. But it might be something that you have to work towards if you're really tight. So Stephanie is actually pretty flexible. She can get her leg up to about a 90-degree angle when compared to her trunk here. You might be starting way down here, and that's okay. The goal is just eventually to get somewhere in this general 70 to 90 degree region to stretch the hamstring. So after your 30 seconds is done, you can lower the leg back down again using your arms. And you would do 3 sets holding for 30 seconds. Okay. So while we have the strap still on your knee, let's do our next exercise. This is a heel slide. So this is going to be one of the most important things that you do post-op. It might not be that challenging prior to going into surgery, but I think it's still an important exercise to teach. So you're going to use, again, your arms and your knee. You're going to bend your knee as far back as it will go. So let's say it goes to about here, using just your leg. Now use your arms to give it a little extra stretch, pulling your heel towards your butt as far as it will go. Again, Steph is able to pull her leg pretty far close to her body. That might not be the case for you, and that's okay. So you would hold it here for a few seconds. It doesn't need to be that full 30 seconds. Unless it feels good, then go ahead and hold it as long as you'd like to, and then you can push your leg back out in front of you. This one you can do as many times as you'd like. So if you're holding it for a longer period of time, you may do less repetitions. If you're just holding it for maybe 5 to 10 seconds, you may do 3 sets of 10 like the other exercises. So this is just a range of motion exercise, stretching from knee extension, trying to get the knee as flat as possible, and giving as much of a knee bend as you can tolerate. So our goal here isn't to inflict pain. Our goal is just to get a nice uncomfortable but tolerable stretch into this flexed knee position. All right. Unhook your foot from the strap. Go ahead, bend this knee up a little bit more, and then straighten this leg all the way out. Our next exercise is a straight leg raise. So I always tell people to bend the opposite leg that they're working on because this helps to support your lower back. Your leg that's going to do the straight leg raise is going to start off straight. Again, you're going to keep your knee or press your kneecap down into the table or bed and then raise your leg up to about the height of the other leg. Nice and slow. Good. And then you're going to slowly lower that leg back down. Try not to let your heel plop onto the mat. You want this good eccentric control of the quad here, and then repeat. Good. You'll see she nicely pressed her kneecap down before lifting the whole leg. That ensures that she's engaging her quad to do the exercise correctly. For straight leg raises, you would want to try to do 3 sets of 10. If you can't get your leg to the height of your other knee, that's okay. Raise it up as far up as you're able to. So if you're only able to get it up halfway, that's okay. That's a good place to start. Any of these exercises that you do now are going to help set you up for success once you're able to have your knee replaced. Awesome. One more tidbit of information is that the straight leg raise post-op is one of the things that as therapists we look at to see once you're doing it really, really well without having a bend in your knee and with having nice form, it tells us that you're ready to start walking with less assistance. So that might mean that it's time to get rid of your walker or your cane or just move from using a walker down to a less restrictive device like a single point cane. All right, next, Stephanie, I'll have you roll to your side so that you're facing the camera. Now, you'll notice we're switching legs here. We've been focused on her leg down here this entire time, but for the purpose of this video, I'm going to switch the focus to her opposite leg just so that you guys can see everything better. Now, the first exercise I want you to do on your side is a clamshell exercise. So you're going to actually bend your knees. You want your ankles, your hip, your shoulder, and your ear to be in a nice straight line. Your knees are out in front. You can prop your head up however you're comfortable and stabilize your trunk with your hand in front just like you've got it. Your ankles are going to stay together and you're going to raise this top knee. Good, and then slowly lower back down. Don't let that leg plop. You should feel the hip muscle back here doing the bulk of the work. The first repetition or two might feel really easy, but if you do this exercise correctly and slow, you will definitely feel this in your hip. So a lot of people think you need to add resistance to this exercise right away by putting a resistance band around the knees, which is great, that gives resistance, but like I said, if you do it well and slow, you can really feel it. So Steph, point to the spot where you feel this exercise.
Right in here.
Right into your hip.
Almost the top of my butt, wrapping around to the front.
Okay, good. So yeah, that's really working her glute. Stay on your side, you're going to straighten your legs out in front, and then actually bend your bottom knee. There you go, just to stabilize yourself. Your top leg is going to be straight. We're going to have this nice straight line again. Ankle, knee, hip, shoulder, and ear all lined up. Your bottom leg is bent to stabilize, and then you're going to slowly lift your top leg up towards my hand.
These are my Jane Fonda moves.
There we go. Good, and then again, nice eccentric control as you lower back down. You should feel this in your hip and butt, your glute muscles. Nice work.
And it should be hard, because it is for me, to go down slowly. It doesn't want to be very smooth.
Nice work, Steph. Awesome. Okay, the next couple of exercises I have are laying on your stomach. Now, not everybody is comfortable laying on your stomach, so if being on your belly isn't for you, that's okay. Don't worry about these exercises. Our goal isn't to irritate other areas like the back. So if you're able to lay on your stomach, you can come to a prone position. Some people find it helpful to place a pillow underneath their hips just because it takes a little bit of pressure off of the lower back. Especially if you're on a bed that has a lot of give to it, your back tends to scoop a little bit more, so those pillows underneath your hip and lower belly can really help. So first exercise I'm going to have you do here is to hook a belt around the foot, just like we did in the beginning with the other stretch. And then you might have to have somebody help you out with this, or set yourself up beforehand, but you can use your hand to pull your foot back towards you. Now, Steph, you should feel a stretch in the front of your quad right here. Okay, again, the goal of this exercise is not to inflict pain, but you should feel an uncomfortable but tolerable stretch in the front of the quad. Again, working towards a 30-second hold if it's tolerable. If you wanted an added stretch, you can take that rolled up hand towel and place it underneath the knee. You'll still get a quad stretch, but you'll also feel a little bit of a stretch in your hip flexor, the front of your hip.
Oh, yeah.
One thing that I find is really important here, and you might need feedback from somebody at home with you, is to make sure that your leg is lined up parallel. So you don't want your leg to be way out to the side. It's kind of hard for you to be able to see that on your own. So, like I said, you might get some feedback from somebody if you have somebody else living at home with you. Perfect. Remove the towel, the belt. Steph, next what I want you to do is to keep this leg straight and raise it up off of the table. Good. It doesn't need to go super far. And then slowly lower back down. Good. Now the key to this exercise is making sure that the right muscles are acting here. So the primary muscle group that should be working is your glute, and your hamstring should kick in second. Your hamstring should not be the only muscle group working. You will know if it is if you start cramping in your hamstring. So one thing I'll tell people to do is to squeeze their butt muscle together first, and then lift the leg. Good. And then have a nice, slow and controlled descent back down. Lower. Can you feel the difference when you squeeze your glutes together first?
Yes, because my hamstring wants to cramp. So make sure you squeeze your butt muscles first.
Yes. If you start to get a hamstring cramp, roll back to your back, grab your belt, hold that leg straight up in the air, stretch the hamstring out, or you can even sit. I'm just going to bend your knee for a second to get out of the way. You can sit on the edge of your table, straighten the leg straight out, and then hinge over to stretch it out so that you can relieve that cramp in your hamstring. Alrighty, Steph, if you'd like to stand up, we have a couple more things standing at a countertop. We're going to use our parallel bars here, but at home you can use your kitchen counter. I'm going to cut the top of Steph's head off a little bit so you can see her legs and her feet. But you can use your kitchen counter, your bathroom sink, just a chair or your walker, just so that you have something sturdy to hold on to. All right. So Steph, what I want you to do is to put your feet hip-width distance apart. Okay, and you're going to hang on to the bars, but you're going to use them loosely for balance. You're not hanging on for dear life. Now, I want you to do a squat, And as you squat down, there's a few things to keep in mind. You're going to sit back as if you're sitting in a chair. The weight should be distributed equally through each of your feet, and your heels should not come up off of the ground. And lastly, for the most part, your knees should not go over your toes. Good, and then slowly come back up.
So it shouldn't look like this.
Yep, you could hear when she went forward with her knees over her toes, her whole knee popped. Which is not necessarily a bad thing. Knees click and pop and do all sorts of things, and we get that question a lot. It's not always an indicator of something bad going on. Joints pop and click. Good. The other thing you want to make sure is that your knees are staying parallel. So Steph, make sure that they don't. Show them what it would look like if their knees went together. You don't want your knees to come together like this. That just looks painful watching it. There you go. Nice job. If you're not comfortable doing it at a sink, or if you feel like it's hard to get good form, sometimes I'll have people actually come to a chair. I'm going to lower this down. So you can actually sit down with me. We'll do this one together. So you'll come to a chair, and the higher the chair, the easier the exercise. So try to find like a standard height chair. Your kitchen table chair, if it doesn't have wheels, is always a good place to start. You can also do this from a toilet seat. That's usually a good height to practice from also. Got to use what you have in your house, especially when you're stuck at home. Okay, so what you're going to do is scoot to the edge of the chair, have your knees stacked over your ankles, sit up nice and tall, shift your weight forward, and you're going to stand up, and then without using your hands, try to sit down. You're just going to kind of barely touch the chair and then come all the way back up. So this is a good starting place if you're having trouble doing the squats at your kitchen sink. Okay. And you would want to work towards 3 sets of 10. Job, Steph. Awesome. Good. Well, we hope that you found these knee exercises helpful, and don't hesitate to reach out to us if you have questions in the meantime. Otherwise, have a great day.
Thank you.